Obviously, we want all children to have the opportunity to be connected to anything that will help them to have healthy development so that they're ready for kindergarten. Those first few years are just extremely important. Social emotional development is interconnected with physical health. Physical health is interconnected with mental health. It's all interconnected. The programs that we've developed in our community may not be designed with immigrant and refugee families in mind. And because of that, and also because there's many other barriers for immigrant and refugee families, they may not have access to some of the same things that all the other children in the community have access to in order to be ready for kindergarten.
I have a child with special needs. I kind of knew that something was not right. I didn't know what it was. But it was through programs that I was able to get help for my child. Otherwise, I would not have had that.
In refugees, we have a lot of issues going on. Sometimes we don't know to who we will raise them. But now these organizations bring everything in the table. So now we know where to go.
The minority community is wanting professionals who kind of would identify with them. So Access Project was able to have that as part of the things they will do, provide assistance to people who can be trained to become professionals in the community. I was already a teacher, and I was interested in transitioning to parent education, so I can work with parents and little children.
When we first started doing this, it was like, well, maybe you can get people to come in to be paraprofessionals, and we said no. We really want them to be into the professional realm, and so that they really have a voice in the program. We have been recruiting people into our parent education program. I think that we now have somebody who will start our early childhood special education program.
When you come to a new place, you're viewed as if you don't know the system, so it appears like you don't know anything. So whatever you know is not acknowledged. But if both groups can say, oh, somebody might come with a fresh idea or a different idea or a different way of doing things, and all be open to it, and then you learn from each other, and it enriches the community.
Florence and I are working together, and we're really talking about, it's not like writing a parent education curriculum where you're saying, well, these are the goals for the parents. We're talking about bringing parents and professionals together, and these are the goals for the professionals, and these are the goals for the parents. And that's a very different kind of interaction, and we talk about it because of some of the training from Blue Cross and Blue Shield as co-learning.
This has been a co-learning project from the very beginning, so that everyone's voice is taken into account, is respected and heard, and we work together to create the project. So we didn't create a project and then ask immigrant and refugee leaders or families to participate. Instead, we all got together and said, what's going to work?
I feel at home. So I think this project is wonderful and it helped a lot.
By doing all this connection with the available resources in the community, we are coming together, we are answering the question together. It helps the entire community we are in.
We have a particular interest in making sure that early intervention is culturally appropriate and access is available to families. But in reality, behind that are so many issues that impact whether families would access something like that. So issues like the concern about child protection and the concern about ever connecting with anyone who has anything to do with a governmental institution or a statewide institution. Also just very different perspectives on what is development. How do you support healthy development? By addressing some of those bigger issues, we also are making sure that any children where there are any concerns, that families would access the services that they need so that those children can get the help they need before they walk into kindergarten.